item, which is the report regarding supporting vulnerable children and families pre- and post-birth through the 0 to 19 Healthy Child Programme service. I think, if I have the names right here, that report is being presented by Barbara Rooney. Hi, Barbara. And then Simon Harding and Kate Howard. Hi, Kate. Hi, Simon. The floor is yours.
Thank you. Good evening, everybody. And yes, I'm delighted that colleagues Simon and Kate are here from Cambridgeshire Community Services. And hopefully, if there are any more detailed questions, they'll be on hand to fill in. So the request for this report really was for us to focus on some of the detail that links to the service provision by Cambridgeshire Community Services for the 0 to 19 Healthy Child Programme service, but with a particular focus on the early years and how that how the service provider link up with maternity services to support pregnant women and moving into parenthood. So health visiting staff, as we know, work in close partnership with maternity services to support parents through pregnancy to post-birth. And that's particularly as they then are looking to become parents, either for the first time or the umpteenth time. And you'll see in Appendix A that we've provided a brief overview of what the sort of core elements of the service are from the 0 to 5 perspective. So just to sort of clarify the commissioning landscape, so the 0 to 19 Health Visiting and School Nursing Service is commissioned by Public Health in local authorities, and all local maternity services, and for us in Bedfordshire, they are commissioned by our clinical commissioning group for Bedfordshire, Luton and Milton Keynes, and they're provided by Bedfordshire Hospitals NHS Foundation Trust. And it may be that some of the questions, if they are specific to maternity services, will be outside of our remit here tonight. So in essence, what happens, that partnership working between midwifery and health visiting, is that once a pregnant woman books in with the local midwifery team, and that's ideally by the 10th week of pregnancy, the responsibility for the care of that pregnant woman sits and her baby, once the baby is born, sits with maternity services. However, the health visiting service does get involved as soon as, and it's around about week 24 of the pregnancy, as soon as they are notified by maternity services that this woman is pregnant and is likely to go to term, then they will, the health visiting service will get involved for that antenatal contact. And that's very much about establishing what the service will be able to offer, talking to the mother, the father, if that's appropriate, about what lies ahead in terms of the birth, and looking at whether there are any particular issues that might need some additional support, etc. So in order for this to happen, there are lots of local pathways and information sharing agreements that are in place, and we've provided some of the details of those. And this is part of the Healthy Child Programme service that is the entitlement, really, of every child. It's a national programme that is delivered locally, and the aim and the intention is that it's delivered at 4 levels. So community, universal elements of the service that everyone is entitled to. If there are additional areas that might need some support, additional issues that are identified, that's what we would term Universal Plus, so maybe some short-term help, additional help, intervention. And then for our more complex situations, more vulnerable families, the service provides what we call Universal Partnership Plus, UPP support. Now, for all of our families with children aged 0 to 19, if they fall under that umbrella of UPP support, they will receive the most intensive support through the service. So health visitors, school nurses will be providing input for strategy meetings, core, initial review, safeguarding meetings, team around the family, any of those young people and their families who would require early help. There'll be involvement from the 0 to 19 service, providing additional home visits and interventions as deemed appropriate. And for children aged 0 to 5 years, there is quite a detailed enhanced programme that is provided. And that's a planned schedule of an additional 18 contacts, 18 contacts in total, which is an additional 13 to the 5 mandated contacts, and you'll see the detail of that enhanced programme in Appendix B. So really I think it's important to emphasise, and it sort of echoes some of the things that Martin's just been talking about, that COVID-19 has for sure added prevalence and complexity to the safeguarding and vulnerable cases requiring support through our 0 to 19 service. And we're monitoring this very closely, and so the latest kind of update, from the period April 2020 through to the end of September 2021, in Bedford, we saw an increase of 69%. That's 192 children aged 0 to 5, and 62% of children aged 5 to 19. That's an additional 132 who required UPP support. And obviously there are some quite significant staffing implications for that. And this has resulted in our health visiting and school nursing service not having the capacity to deliver all of the universal elements of the Healthy Child programme that they had been able to deliver prior to the pandemic. And that's simply because they've needed to concentrate their resources, or more resources, should I say, on increasing numbers of children and young people requiring that additional support. And you'll see in Appendix A, we've tried to kind of just give the headlines really of what the current model of provision looks like. So that's Model A in Appendix A. And then what the planned model of provision will look like moving forward, because CCS colleagues and commissioners and partners and stakeholders have been working collaboratively to develop a refreshed service model that will restore some of that universal provision of the service that we had in place. Both local authorities, so the service is commissioned across Bedford Borough and Central Bedfordshire jointly. So both local authorities have been able to, within public health, identify some additional non-recurrent funding for a fixed period of 2 years. So it's obviously starting this year, running through to the end of 2023. And the aim is to be able to recruit some extra staff to support returning to those pre-pandemic levels. There is a caveat to this in that, and Simon and Kate may well want to say a little bit more about this, that we are facing a national challenge, which we're certainly seeing locally around the recruitment of qualified health visitors and school nurses. To the point where we may struggle throughout the next 18 months of this additional funding that is available to recruit sufficient numbers to deliver that pre-pandemic service model. So I'm going to stop there, and there may well be some more specific questions that members have, and obviously, as I say, Simon and Kate are the experts from CCS. Thank you.
Okay, thank you so much. Before continuing, I'd just like to highlight that the Health Overview and Scrutiny Committee has also reviewed parts of this service. So in July 2021, they reviewed the health visiting service, and they particularly focused on the issues relating to the in-person visits to new parents, or probably lack thereof because of the pandemic, and they've agreed to receive a further report. Just highlighting this because there's a bit of a crossover between kind of health and children's services here. So yeah, we can only kind of make recommendations regarding issues that are within the scope of this committee. Martin, I don't know whether you want to say anything more about kind of what falls within kind of children's services or...
I think I'm not sure that I can add too much to what Barbara's already said. I think we're facing similar challenges, and I think that Barbara summed that up very nicely. I think that what we do have, and what's increased over the years, and certainly over COVID, is that the communication between the two organisations is very good. We're supportive of each other and trying to identify, and where we have identified families that are in need, then the professionals that are, the practitioners that are on the ground that work together with those families are working together very well, and the communication between them is certainly helping to keep those children safe and to meet the needs of those families. But yeah, the challenges, the strategic challenges of recruitment are similar. I mentioned them for social care, and they're very similar to the ones that Barbara faces.
So just so I understand, so the same families are often helped by both health visitors, school nurses, and then some of our social workers. Is that how it works?
Absolutely. Those families that are subject to child protection plans or that are being supported as children in need, there will often be a large degree of crossover between those families. In fact, most of those families I would have thought would be part of the UPP programme, which Barbara mentioned, and getting that additional support from them, as well as getting additional support from us.
Okay, great, thank you. Okay, thank you so much for that report, Barbara. Are there any questions for Barbara? Councillor Meader.